Alright, hey, my name is Chris Fry. This is my medication administration video. Here's my nursing ID, and then scan the room. Alright, with that, we'll go ahead and get started. First, we're going to verify the medication order, and with that, we will pull out the patient's chart as well as the medication administration record. First, we'll verify the right patient. We have Jaguar J. Jones, the right medication, morphine sulfate, the right dose, 5 milligrams, the right route, IM intramuscular, and the right time. We have every 4 hours as needed for pain, and we see that there is no record of this medication being given within the last 4 hours. So after that, we will check for any allergies, and on the chart we see that Jaguar Jones has an allergy to penicillin, and on the MAR we see that there is a allergy to penicillin. So now we will perform hand hygiene, and we will pull out our medication, and we have morphine sulfate, 10 milligrams per milliliter, with the expiration date of 12/20/2025, which is in date. So with that, we will go ahead and we will use an alcohol wipe and sanitize the top of our vial for 15 seconds. And we'll also go ahead and re-verify that we're giving this every 4 hours as needed for pain, and we see that it has not been given, and we're giving 5 milligrams. Well, because we're giving 5 milligrams and this morphine sulfate has 10 milligrams per milliliter, we're going to be giving only half a milliliter of this solution of morphine sulfate. We'll go ahead and verify that we have morphine sulfate on our MAR and on our vial, and we are giving this intramuscularly. So with that, we will be using a 3 milliliter syringe and a 23 gauge needle, 1 inch long, as well as a blunt needle to extract our medication from the vial. So next we will go ahead and extract our medicine. And we'll go ahead and pull out half a milliliter of air and inject this into our vial. And we'll pull a little more than half a milliliter to ensure that we don't have any bubbles. All right. There it goes. All right. I'll go ahead and show the half a milliliter. All right. And we can go ahead and remove our blunt needle, and we will use the scoop method. Go ahead and remove that and dispose of that in our sharps container. And we will go ahead and put put our 23 gauge needle on. And we will go ahead and verify our drug one more time. We see that we have morphine sulfate, and we have morphine sulfate 5 milligrams, so we are giving half a milliliter. Intramuscularly, so we have an intramuscular syringe, and we're giving it every 4 hours as needed for pain. And now we will go ahead, and I have a label for this, and we'll stick this. This also has Jaguar Jones's name on it. And we'll go ahead at this point, and we would normally have a nurse verify our calculation and our dosage before we left. So now we will we'll go to the room, and here we will check. We'll go ahead and verify our patient. So we have Jaguar J. Jones with a medical record number of 417-6352-6352. So next we will go ahead and check for any allergies, and we see on the MAR that there's an allergy to penicillin. And we see on the armband that there's a reaction to penicillin. So we would ask Jaguar Jones what kind of reaction does they normally have to penicillin, and let them know that we are not giving them any injection of penicillin. Because we are giving morphine sulfate for pain, we would go ahead and assess the patient for their pain level on a scale of 1 to 10. We'd ask them, as well as we'd take their blood pressure, as an elevated blood pressure can be a sign of pain. And so next we'll verify one more time. We have Jaguar J. Jones, morphine sulfate, 5 milligrams. We're giving 5 milligrams, which is half a milliliter. Intramuscularly, every 4 hours as needed for pain. It has not been given within the last 4 hours, so we are good. We will now perform hand hygiene, and we will lower the bed, or raise the bed to the adjustable height and lower the side rails. We would also explain the procedure to Jaguar Jones, and we'd say that we are giving a shot of morphine for pain today, and that we'd let them know when we're going to give it just be a slight pinch. So now we will don our gloves. All right, and for this injection, we will be using the ventrogluteal area. And so we'd place the heel of our palm on the greater trochanter area with our index finger going down the anterior superior iliac spine, and our middle finger going down toward the iliac crest. We would assess for any bruising on the skin and for good muscle, and we see that this is good muscle. So next we will clean the wound with an alcohol wipe. If I could get it open. Cleaning in a circular motion from inside to out. Next we will remove cap. And we'll go ahead we'll aspirate for blood. We see no blood. Inject slowly. and pull out. And we'll apply light pressure to the wound. We will discard our syringe into the sharps container, and we will, as we take off our gloves, our clean gloves, we will assess the patient, observe them for any allergic reactions, ask them how they feel, and we will document how they feel and how they took the pain medication, and we would leave the room, and about 5 minutes later we would come back and we would reassess the patient and make sure that there was no allergic reaction. That concludes my video.